Every year, so many couples in this country, millions in fact, face infertility problems. It's a horrible thing for a couple to hear, and this happens to be National Infertility Awareness Week. The important thing to know is that there is so much help out there for couples facing this problem, and we're happy this morning to welcome Doctors Rink Murray and Jessica Scotchie from Tennessee Reproductive Medicine talking about infertility. Nice to see you both. Rink, you are a veteran on the show, and so you called me this morning and you said, okay, I brought a prop. I thought, how do you bring a prop for infertility?
Well, I didn't know what I didn't know if I should bring something that caught on fire, but because we don't have anything like that. I figured it'd be more exciting, but we have this with us today.
What you brought, and what is this called, Rink?
This is actually a doer, and this is a travel doer, so it's not as big as the one we use in clinic. But this allows us, one of the newer technologies we have is the ability to freeze eggs. And we can take eggs out of a woman who maybe is facing cancer therapy or who is getting ready to go off on a big educational process and is not married and is worried that when she finishes and she's ready to have children that she won't be able to. So we can stop the biologic clock by getting eggs out of her and putting it in a doer like this. And this stays at less than 340 degrees really. And it can stay there, and we really don't know how long it can stay there.
So what you're saying is that by doing this, a woman who's going to go, say, to nursing school or is just facing a difficulty in her life and has to put off having children, and she knows she does, can go ahead and have this procedure done and essentially stop time, so that when it's time to have children, the embryo is a healthier embryo.
That's right.
Is that right?
Yep.
All right, I want to bring you in, Dr. Scotchie, because it's important for women to know that you are there in the practice now for about 4 years. A lot of times women come in and they want another woman who can relate.
Yes, it is. It's nice that we complement each other, I think. But we really do both try to focus a lot on the emotional stigma that's attached with infertility. A lot of people struggle with feeling that they're incomplete, that they're a failure, and it's simply not true. We really try to individualize our evaluations and help couples know that there's hope out there so that we can help them down this journey.
Dr. Murray, you said as many as 15% of couples will experience this problem at some point.
That's right.
In their marriage.
That's right.
So what is it that you hear most often when people come to you? Are they simply distraught and at a loss for where to turn?
The closest thing that grief counselors will tell you that it's like the loss of a loved one, because it's the loss of your future, it's the loss of hope. And you know, a huge part of what we do is helping patients know that they're not alone and what to expect, and some of the negative feelings that they feel about themselves, they really turn that inward on themselves, and we try to release them from that. And you know, counseling is about half of what we do, treating is the other half.
You need to realize, and y'all do, that there are so many complexities to this problem, because there is the physical, there's also the financial. Yes. So you're doing now something there in your practice called natural cycle IVF?
That's right.
Is that right?
Do you want to take this?
Yeah, sure.
Tell me what that is and why it can save people money.
Right. So IVF is a short way to say in vitro fertilization, which is when we're taking the eggs out of a woman and fertilizing them with the partner sperm and placing the embryo back into her uterus. Now, traditionally, we use very expensive injections to stimulate lots of eggs for a woman, which are very costly. However, for some people, they don't really need a lot of eggs to undergo an IVF cycle. They may need only one. And so we can actually do that process without all of the costly medications, dramatically bring down the cost, and still give them very, very good outcomes. So natural cycle IVF is something we're now offering, and we're, to our knowledge, the only clinic in the Southeast right now that is actively performing this.
And that's so important, because if you have already gone through, I would imagine, rather expensive testing just to discover what your particular problem may be, your resources could be running out, and insurance typically will not cover it.
Correct.
All right, talk to me too, while you're both here, brag a little bit for folks who don't know all that you do about your involvement start to finish in this process, because you're there every step along the way.
Yeah, we opened this clinic and said, you know, a lot of places say you're not going to be treated like a number. We really have strived very hard to be mission driven, to say we're going to be there for every important procedure you have. Whether you're coming in for an ultrasound, you're going to see one of us. If you're coming in for a small treatment, you're going to see one of us. If you're coming in for a big treatment, of course you're going to see one of us. We don't get to call every patient back with everything, but we definitely have hands-on approach with the patient, and I think that gives them the most patient-to-doctor interaction possible. Yeah.
Is there anything such thing as a typical patient, or is it a case where every story is unique, therefore everyone needs your attention?
Everyone really is unique. I mean, two people can come in with the exact same diagnosis, but it might be the emotional impact that's very different, whereas one really wants to exhaust conservative measures and the other one is distraught and needs to get pregnant immediately. They may choose a more aggressive route, so it truly varies patient to patient.
It is National Infertility Awareness Week, a time to realize that so many people are struggling to have the family that they hope to have, but there is help out there. And just don't give up. If this is describing your life right now, you can get advice and help. Tennessee Reproductive Medicine, there is the phone number, and the website, trmbaby.com. So nice to see you both. And Rink, thanks always for the prop.
Well, thanks for not making me bring a baby.
You can do that next time.
All right.
We're back with more right after this.